Hi there. Welcome to The Preventable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The Preventable, brought to you by our amazing friends at Hubbard, who donate our space twice a month, as a matter of fact, with zero expectation in return. It's really great, so shout out to Hubbard. With me today is Ben, who is the Director of Substance Misuse and Behavioral Health Services. Whew, that's a mouthful. From Williams & Associates. Welcome, Ben.
Thank you so much for having me.
Williams & Associates. Some people are listening to this going, what is that? And I think that it is one of the best kept secrets in this region. So can you tell us a little bit about what Williams & Associates is, what they do?
Sure. So we are a minority health group, nonprofit. We are definitely geared towards the Black community. However, we are open to everybody. We are very, very much LGBTQ friendly. Our mission is to provide public health education, prevention, wellness, treatment interventions that address health disparities while promoting health equity for Black and other marginalized people. We were founded in 2002. I have been with them since January of 2022. So it was founded originally by Mr. E. Rise Williams.
Such a great man.
Awesome
I love
guy.
him. Just a big teddy bear.
I love him.
Yeah.
Hey, Mr. Williams, if you're watching this, I love you. So Mr. Williams and also Mr. James Green.
Yeah. Yes. So, Mr. Green.
Yeah, two really awesome people that founded the organization. And
can you take me back? Like, why did they found it? I'm assuming it's because there was not another organization that was doing this kind of work.
Not enough of, there still isn't enough in my opinion. But they definitely, there's a need in St. Louis City for what they provide and the services they provide. And, I feel very lucky to be a part of it. So
a couple of years ago, we actually gave Williams & Associates one of our awards. So every April, we honor people, organizations who have been doing the work in the field. And E-Rise and I think Mr. Green came to accept the award. And I just think that Williams & Associates is kind of one of those organizations that has been doing the work, but isn't in it for the clout.
Right.
You know?
Yeah, I agree. We definitely try, and we definitely try our very best to get out in the community. We're always looking for ways to engage with people and finding unique and creative ways, to get out there. When I first started, we had the idea of actually going to some of the some of the motels and high risk areas, if you will. And one of them, we tried going to Grand Hotel. Which they actually wouldn't let us, because we were trying to rent out a room at first so that the people around that area could come in, they could get the testing they needed, they could get their services they needed, handouts, do surveys if needed. We tried doing it that way, but it actually wasn't really ideal as far as safety goes. So now we're able to partner with a lot of other really cool organizations. ARCA, for example, they've got a really neat mobile unit they put a lot of money into that, so we're able to try to do our best to follow them around and hop on board with them and get out to the areas that need it.
And when you talk about testing, specifically you're talking about STI testing.
Correct. So one of the big things we do, this is all free for the community. We do free STI testing, HIV, chlamydia, gonorrhea, hepatitis B and C, and syphilis as well. These are things that, if we've got 3 locations really that are available. Again, it's free for the community.
And STIs in general are pretty big here in the St. Louis region, but are the rates, we're one of the leaders consistently, right? Do they impact people of color disproportionately, like substance use disorder does?
They can be, yes. So, a lot of these issues are disproportionately seen in the Black community. It's something that it's just
because of a lack of resources, a lack of trust, a lack of all of that stuff. So by embedding in the community, and you all, correct me if I'm wrong, but you use people with lived experience. You employ them, right? So that they're the messengers.
Yes, of course. We've got engaged, and the answer is yes. So we've got engagement specialists and outreach workers that are out there in the field, and many times we'll go together in groups at times, but definitely people from the same areas and whatnot that are engaging with the community. So.
And that's actually why we started working with Williams and Associates, because we realized, too late, of course, like 4 decades too late, but we realized that the messenger is just as important as the message. And so for us, it made sense for us to partner and contract with Williams and Associates, who employs people of color. Many of them are identify as LGBTQ. Some of them, I'm sure, have lived experience and are in long-term recovery. But we knew that it would make way more sense if we could contract with your staff to go and deliver the overdose rescue kits with the Narcan and the fentanyl test strips, because you're going to areas where, like, someone like me, like, I can't go. Not because it's unsafe or anything, but because people are going to be like, what the hell are you doing here?
Right.
Right.
And yeah, I mean, and it's not really, in my experience, honestly, I haven't really had that experience, to be honest with you. I felt that way sometimes, sometimes when I'm out there.
Yeah, so let's talk about the elephant in the room.
Right.
You are not a person of color.
No, I'm not.
Right.
But,
so do people kind of go, what? Why are you working for Williams and Associates?
Probably, I'm sure. But the bottom line is, everybody that I've come in contact with and worked with, it's been one of the best experiences of my life, so it's been really cool. It's been, I don't know how far back we want to rewind.
Let's do it. So what got you into this field, man?
So I'm a former high school educator.
I taught middle school.
Yeah, so
that's great.
Previously went into high school education. And then I went to medical school. So I went to medical school.
Did you teach science or something?
I was a science teacher in high school.
Oh, okay.
And I had always, in the back of my mind, I'd always looked up, and I'd always, I guess the big thing with me is I always wanted to pursue a medical degree. I always wanted to be there, wanted to be educated about it. I wanted to learn everything I could about the human body, about sciences, about medicine, about everything. It was kind of just my dream. The bottom line is, I knew that if I didn't do it, I'd always be telling myself I could have done that. I could have done it. So anyways, I did go to medical school, and I did end up actually, I was in a residency program for family medicine in Terre Haute, Indiana.
Huh. Larry Bird.
Larry Bird, that's correct. French lick to Terre Haute.
Yes, that's right.
So, but I don't want to go too much into that. But the bottom line is, that wasn't the work environment that it was right for me. So I did leave that at that time I left. I left the residency program, came back to St. Louis.
Do people often leave residency programs?
Not really.
I was going to say that seems
really.
Kind of like
Not really. So, but I did.
But you did. It wasn't right for you.
The bottom line is, I don't know. The people that I was working with at the time and the area in Terre Haute, I was not in love with. Yeah. And I came back to St. Louis, met my future spouse, met my wife to be. I came in touch and met Mr. Williams, and a lot of things we talked about, a lot of things that when we first met each other, we kind of saw eye to eye on a lot of things, and I felt that I could be effective in the role that was open, and I feel very fortunate they gave me the opportunity. So that's kind of what leads me to where I am now.
That's great.
So
that's awesome.
So yeah, where were we? How do we even get in this?
I don't know, but it doesn't matter.
Right.
Here's my question. So for people who don't know a ton about Williams and Associates, my understanding, correct me if I'm wrong, is that the bulk of your funding comes from like grants and contracts.
Right. So,
and you have some fundraisers.
Exactly, we do. But the bulk of it, we are a nonprofit. We are funded by grants, the majority, as far as I'm aware. My job, my role, I am very much involved in the SAMHSA grants. So SAMHSA stands for Substance Abuse and Mental Health Services Administration. So that's definitely kind of like my area that I do. So along with the STI testing that we do, and that also does involve the counseling and education.
That's
and
right.
Linkage to care and everything like that.
Like after an STI diagnosis.
Absolutely.
Yep.
Absolutely. And keeping them informed.
Because I'd imagine your brain explodes if you get an STI diagnosis.
Right.
For most people,
yeah,
right? They're kind of like,
Well, when they come in, you want to make sure that they feel comfortable and that they're informed. But you're also going to want to let them know that it's not the end of the world.
Correct.
If something happens.
Correct.
We're here for
a lot of these are treatable.
Absolutely. So,
antibiotics can make several of them go away, but then like how do you talk to your partner about it too?
For sure. So
or
that's
your
something we actually have
partners?
too.
Yep.
We also have some things that have happened pretty frequently is somebody has a new partner and they want to make sure that they're safe, and we've had people come in together that get tested, and but the overall experience is as within even the STI realm, it's been overwhelmingly positive, and I've found that people are very appreciative that we're there for them, and they like not having to pay for it either. So
well, yeah, that certainly helps.
Right.
When I used to work before Prevent+Ed, I worked at the Jefferson County Health Department, so rural, and we would do a ton of STI testing, and we did like the Gardasil vaccine when it first came out for HPV and stuff, and I sat right across from the desk of the person who would have to make the call, right? So they came in, they got a test, and back then you had to wait. So the epidemiologist who would call and say, like, I'm so sorry to inform you, but you have come back positive for this, and, we need to talk to your partners. Right. And there was usually, like, dead silence. Yeah. Like, I'm not doing that. Like, right. I'm not calling whoever to tell them because or anger, because it's like, how dare they infect me with chlamydia or whatever. So your counselors who do that piece, I would imagine that they have to have a pretty decent amount of training in conflict de-escalation and, empathy and all of that stuff.
Yes, they do. So their official title is engagement specialists, but they are very much well-trained and well-versed, and bottom line, very empathetic and caring people. And Vanessa, shout out to Vanessa Frost, and also John Pounds, our new engagement specialist on board. But they're very well trained in my opinion, and they are also very much there for the community and an integral part of the community in my point of view. Vanessa Frost is I'm not sure if you've heard of her before. She's also involved in rehab.
No, but that doesn't mean anything.
Okay.
So tell me about her.
So Vanessa, short story about Vanessa. She's also at rehab in St. Louis, off of Manchester, the Grove area.
Oh, rehab, the restaurant bar.
Correct, or like the club.
Yeah,
so she's also like a performer there. Oh, so she's very much in.
Okay.
Yes.
Okay.
And she's we're it's great working with her. We love having her here with us. So.
Okay, so I realize we're about to enter some tricky territory.
Okay.
We can always edit this in post.
Sure.
And it's tricky territory for me too, so I'm going to be careful. With all of the things politically happening.
Right.
Okay. Has there been an influx in people utilizing your services because they're concerned about their safety or their mental health? Or do you know if like rates are staying the same? Because
it's hard to say about if it's due to with the things going on as far as safety and whatnot. It's hard to say if it's due to that or perhaps we've just been getting the message out more to people.
Okay, that's a positive spin on it.
So yeah, but I'd say we've been doing pretty good at we've got 3 locations. One's at West Florissant and 270 off Denham Road.
Okay.
One's at North Kings Highway and Natural Bridge.
Yeah.
And the other one's at down south and Arsenal intersection, right next to Tower Grove Park.
Yes.
But I would say business is good. We're definitely getting an influx of people. I can't say that it's due to the safety or what's been going on in St. Louis.
Yeah.
But I know that crime has been going up a little bit and.
Yeah. And I was at a convening the other day with some people from Squish, which is the LGBTQ kind of peer support line run out of WashU. And they were talking about the fact that, as there's increased attention on the LGBTQ community and isolation and being misunderstood and being marginalized is already there, and then it's kind of that magnifying glass that it's just sort of created this like powder keg,
Right.
Which I can only imagine is contributing to. I mean, what's great is that the resources are there, right?
Absolutely.
And so what's nice is that people are reaching out, and I know. I mean, this sounds terrible to say, but we are busier than we've ever been before. So yes, to your, what you said, business is good. I'd love to like work myself out of a job. I would imagine you and E-Rise would as well, right? Like it would be awesome if Williams and Associates didn't have to exist.
Right.
The fact of the matter is that ain't happening anytime soon.
Of course.
So as long as y'all are there, then that creates the safety net.
Yeah.
You have done a first. You've brought some resources.
Yes. So we mentioned the STIs.
Yeah.
We mentioned some of the Narcan distribution.
Yep.
So some of the other things we do also is very much like mental health related, mental health counseling, all for free. So basically,
so do people have to go into one of your offices?
So we can do it over the phone as well.
Okay.
I have done over the phone. I would say to get the biggest bang for your buck, quote unquote, it would be best to come in person as usual.
Do you offer like transportation vouchers?
We do actually. We do. We have that. So that is something that we have as well.
And when you're, let's say, like at Tower Grove Pride or you're at the Annie Malone Parade and you have your booth, do you provide services at that point, or is that where
we can? I mean, it just depends on the situation. Sometimes we have done active testing right at the location. What's been challenging with that at times is people want their privacy, of course, too.
Yeah, right.
So that's and also
and in the middle of Tower Grove Pride, there's not a ton of privacy.
And also,
there.
I think last year the weather was scorching at one of the events, so it just depends. But for example, like 314 Day, we had a barbecue that we did.
Oh, cool.
And then that was close to one of our centers, so people who wanted to have testing done could just go right inside and have that done. So it depends. Part of the grant situation is you have to have like certain surveys done also.
Pre and post tests and all the things, right?
So that is, the numbers do count. The people who review us, they want to see what have you done and what are your numbers like. It's probably one of the more challenging things, balancing that.
Talk why? Why is that for people who don't know?
Because you can be out there doing good and you can be interacting with people and, I didn't get a survey on them, or they didn't want to do a survey. And you can be doing a lot of good and you can be distributing condoms, or you can be out there distributing Narcan or what have you. And maybe you didn't get I think they're called a GIPRA. We call them GIPRAs for Government Performance Reliability Act.
Yep.
So essentially it's a survey that the community member will fill out, kind of to show that they've been engaged and that they're interacting with us. And that's also information that the government wants to see.
Right now, it's the tool for engagement.
Correct.
Right? Whereas there are other ways to measure engagement.
Right. So it's just challenging, and like,
our peers face the same thing.
Right. And so every month we have a quota that we want to fill for our treatment side of the grant and our prevention side of the grant, just making sure you're doing that. Also following up with people. So for example, if someone did a survey, a lot of those surveys will include like, we'll follow up with you in 3 months or 6 months. So I would say that's pretty darn challenging. One of the reasons why is just because the people people we're working with, their phone numbers change. They give us a wrong phone number. The number's no longer in service, what have you. So that is definitely it's kind of a frustration, but it's just the reality of what we're dealing with, and it's okay, But I will say I have to meet with the project officer every month.
Yep.
And it's like, the follow-up is not so great. Okay, here we go. So,
and it's like you're trying, right?
We
like,
are.
I mean, we face the same challenge.
Yeah.
Like, and many times, like, we do follow-ups for our peers and our counseling and our early intervention with our teens.
Right.
Well, we'll do a 3 and a 6 month follow-up. And a lot of times we call and they hang up on us.
Right. And there's people they think also you're trying to, you're selling
them something.
So,
you're like the government trying to whatever.
Right.
Or for us, it's like I don't know if this is the same for you, but on our counseling and assessment and referral side, for most people, we represent like the worst day of their life, right? Either the day that their kid got in trouble from school and is on, 90-day suspension and they feel like they failed as a parent, or it's the day that the bottom dropped out for them, to use a trite euphemism, and they're deciding that they need to do something. right? It's like the day that they don't want to think about. So when we call and we're like, hey, I'm Nicole from Prevent+Ed, they're like, and I'm done because I don't want to think about that anymore.
Right.
So the follow-up is really hard.
It is. Yeah.
And you understand why it's important, right? Because we
Right.
want to see if we're moving the needle.
Right. So, yeah, that's definitely a challenge. And but other than that, something I wanted to add too is the surveys we do incentivize those. So we give gift cards to like a Schnucks gift card if they participate. So just want to include that. But yeah, the follow-ups can be tough.
Yeah. So you do the STI testing and prevention. You do mental health counseling.
Yes.
And what is the top thing?
So
that
these
you
are all.
brought?
I brought these along just because. So this is Smart Recovery. This is something. Here we go. You can buy this on Amazon, by the way, for like $12.
Shameless plug. I like
right?
it.
I don't work for them.
Maybe
I don't make any money
Smart
for it.
Recovery will be our next sponsor.
I really like Smart. So Smart Recovery stands for Self-Management and Recovery Training. It's pretty cool. It's if you actually go on your phone, it's a free app also. You can go download the Smart Recovery app and you can type in your zip code. It'll show you all the sessions that are going around, like around your location. I've actually gone to some of them on my own just to check them out to see what are they doing that I can do better mine. We do ours at the moment every Thursdays from 6 to 7. It's
at all of the locations.
It's 6 to 7, yeah.
At all locations, or
the
just
one that I do is at South Grand, Grand and Arsenal. We'll probably include our addresses in the description.
Yeah. So Smart Recovery, just for people who don't know, is
anybody with any addictive behaviors whatsoever. So whether or not that's alcohol, smoking cigarettes, shopping, eating a healthy diet, sex addiction, you name it, whatever type of addiction you got. Smart Recovery, it's an open conversation with people. It's an open dialogue. We start at 6 o'clock and we end at 7 o'clock.
And it's not tied to a particular, like it's not the AA model.
It's not AA. It's not AA.
Okay.
And you know, it's not I'm an alcoholic or I'm a, what have you. It's I'm John or I'm Emily or I'm Ben and I have a struggle with my diet. It's something that will work. I have an addictive behavior that is struggling with cigarettes or what have you, whatever it is. So it's not AA. We don't really include anything like, it's not really like religious affiliated or anything like that. It's very much an open model, an open discussion. I like it a lot, actually. I've the people that have showed up, the clients, I've become friends with them for it's a nice thing that we do, I think, for the community.
Yeah. Oh no, it's great.
Right.
You were a high school teacher.
Correct.
And then in residency.
Correct.
I'm not asking you to bear skeletons in your closet or anything, but before you got into this role, had you had training and expertise or life experience in recovery or in mental health?
Yeah, there had been some experiences for sure. I would say probably the most influential on me is, I've seen friends that have struggled with certain issues. I actually lost a close friend of mine. I would say he was a close friend, but he was definitely a friend of mine to an opioid overdose. I also have had people who've gotten into a number of people with alcohol-related car accidents. It's pretty sad. I don't want to go too far into that, but I would say
it's tragic. Yeah, it's tragic.
And then not to get too into it, but I would say that alcohol, even within my family, we have. I have German and Irish ancestry, so we've historically love our beer and our alcohol, and that's something that I've learned that that's something you've got to be able to. You can't let that control you. You've got to control it.
Yep, you gotta manage it. So you meet E-Rise, you have a conversation. You're like, yeah, Terre Haute really wasn't for me, and he's like, I think I got a job for you. So did you have to go to training and in all of these things?
I did get SMART certified, which is really, it's honestly not very complicated to do that.
He doesn't mean that. He means it's very complicated and very stringent on the level of certification, right?
Of course.
Yeah, right, exactly.
No, but I mean,
I'm kidding.
What I mean to say is that it wasn't like backbreaking or super stressful.
Yes.
I enjoyed getting certified.
It's kind of like mental health first aid training.
Right.
It's something that's necessary to get the certification, but it's not brain science.
I agree.
For Pete's sakes.
I agree. So, and it's all like very, very practical tools, and that's what I like about it. One of the activities that I like is called cost benefit analysis, and what that is, it's incredibly simple. So. Just being with somebody and drawing on a board, having the pros of a certain activity, like what am I getting out of it that are good, and the cons, the negative things out of that activity, and then just letting that individual kind of come up with their own conclusions. And for example, if you're talking about alcohol, like a pro, like I might think that I'm a lot funnier, or I'm a lot better dancer, or a lot. At that time, for that momentary point in time, for those 3 hours, I'm having a great time.
Right.
And then so that's great. You can have that. And then on the cons, you can talk about hangovers. You can talk about the potential of self-harm or hurting someone else, of potential blackouts. The list goes on, and it's different for everybody. But I enjoy that activity because it's different for everyone, and I kind of like having the individual come up with their own deductions, if you will.
Yeah.
So that's just one of the activities on there, but it's all very practical things. And another thing that we do are clear sessions. So long story short, there's a lot of overlap between these, but CLEAR stands for Choosing Life, Empowerment, Action, and Results. It's designed for people with high-risk behaviors, and also people with HIV. But again, I believe that it applies to anyone.
So is it high risk and HIV? So if,
people
let's
with
say
HIV and or high risk behaviors for HIV.
I see.
So now again, in my opinion, it could apply. These are very practical tools that are helpful for anyone.
These are like life skills, no matter who you are.
Yeah,
right.
absolutely. And just getting to know the client or the community member and talking to them about their goals, whether that be short-term and long-term, talking to them about how they view their ideal self and what they want to do to get more to be that type of person, having them kind of self-reflect on, certain things that, for example, like stigmas, for example.
Yeah.
Reflecting on stigmas and basically how to respond to those and negative self-thoughts and whatnot, how to react to those, how to change those into more positive thinking and whatnot. So it's something it's definitely very, I really enjoy it. I like being able to interact and work with the community member.
And I bet it's funny because it certainly is for me. Like when I'm, sometimes I'll still pitch hit and I'll go into a classroom and I'll be talking about like decision making or coping or, working on a team and taking turns. And then I'm like, wow, I should really listen to my own advice. So I can imagine that a lot of these life skills, which is really what they are, have benefited you personally and the other people who
of course I still
are doing
reference
the work.
The material and I definitely would still. One of my favorite things that we were in a group one session and one guy came in and he said, I'm here to rediscover my soul. And because we all went around.
Did you put that in your SAMHSA grant report?
I did not. But I was like, all right, okay. And because I think one of the first things we do when we get to one of these sessions is you've got 2 minutes. There's a timer. You can introduce yourself. What you're here for, how your life's going. If you're struggling with anything at the moment, feel free to share. And you'll have your addictions here and there. And this guy just said, I'm here to explore my soul, and here we go. So.
Whoa.
Yeah.
What the hell is next for Williams and Associates? I mean, y'all have been
to the moon.
Right.
That's not my.
I know.
I hope I hope the company continues to flourish and do well. I think there needs to be more of these types of organizations. But at the moment we're doing pretty good. We've got 3 locations.
That's crazy.
We can put that in the description, and then also our website, which is a pretty nice website. It's minorityhealthstl.org. So that's something that I encourage people to check out.
Thank you so much for being here. I know you were sort of volunteered for this, and
thank you for having me. This has been awesome to be here. So I really appreciate it.
I knew that we had kindred spirits in the fact that you were in education. So did you ever think you'd be doing this, BT Dub?
No.
Right.
Life is,
I know.
always changing. So.
It is.
Yep.
Thank you so much for being here.
All right. Thank you.
If you like what you heard, if you want to find out more information about Williams & Associates, please consider rating, reviewing, and subscribing to The Preventable. Thanks.
Thanks for joining us at The Preventable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at prevented.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The Preventable.